There is a commitment on our part that we'll implement those solutions very fast.
As many hospitals across Quebec operate at over 100% capacity, hitting a critical point, the Quebec government is launching 3 key measures that will be implemented in the coming days and weeks, suggested by their new crisis unit made up of nurses, doctors, and ministry officials. Dube's announcement comes the same day a letter was made public from the heads of Quebec's emergency departments saying ERs in the province have reached a breaking point.
I'm looking forward, and in fact, I'm meeting most of those doctors tomorrow morning in Quebec City. There was I think we all appreciate what they're saying because they're right. I mean, we should act on certain things.
The new plan includes opening in the coming weeks 2 clinics in Montreal run entirely by nurse practitioners. Also, the phone line 811 Quebecers can call to be directed to health care, now extended to pediatric patients. Dube says the third measure includes moving patients out of hospital who can't be returned home and don't have a spot in a long-term care facility.
When the people have been taken care of, they had their operation, we can send them to a place where they're safe and they can have their rehabilitation or whatever.
He says the government has put out a call for tender for 1,700 beds outside the hospital network.
The absolute volume of people coming to the emergency room is the same as it was in 2017, 18, 19, albeit more seriously ill, but there are hundreds of beds closed. And so that is what drives right now the length of stay in the emergency room up.
According to ER tracker Index Santé, as of 2 p.m. Tuesday, the hospitals with some of the highest number of beds occupied included the Jewish General Hospital at 198%, Montreal Children's Hospital at 175%, and the CHUM at 167%.
We're under pressure. We want to perform the best we can for our colleagues and for our patients and the people in our society. But it takes a toll, and we're getting tired.
Nurse Naveed Hussain attributing this to the ongoing pandemic and the lack of staff.
When you add on the fact that this is flu season, we have RSV going around, children are getting affected as well, adults are getting affected, it adds to the crisis, and if we don't have the resources or if we don't have the ability to care for them, we'll see people slip through the crack.
This job will not be finished today. This is just a start, but it's a start of working together.
In Montreal, Alyssia Rubertucci, City News.